Good afternoon. I want to talk to you today about scoliosis. This has been a love of mine, taking care of people and kids who have scoliosis for the just about 23 years that I've been in practice. And why is this important to you? Why do you need to know this? And how do you know if your child has this? So what is scoliosis? Let's talk about that to begin with. When we look at the spine, so we look at the spine from the back of the head all the way down to the tailbone, and we really should see a straight line. That's balance. We're always looking for balance in the body, within the spine. The nervous system actually runs right through the spine. The spine, these hard bones, protect it so that nothing happens to it. It's your nervous system. So it must have serious protection. So we want to see a straight line from the back of the head all the way down. When we look at the spine from the side, you see those curves? That is normal. And the reason that's normal is because the curves, we look at the neck like that, so the curve, the neck and the neck should have a backwards C curve, just like that. I don't know if it's forward or backwards on your end, because of the way I have the phone flipped. But either way, it should have a curve to it. And what that does is, if you imagine the tendons and ligaments as you walk or you run, whatever your activities are, they're nice and relaxed, they're responding to you, but a lot of people end up with changes in the shape of these curves. And so if we change that shape, now suddenly we are stretching and overstretching those tendons and ligaments. And so anytime the curves change, we're going to get stress and strain on the tendons, the ligaments, the muscles, and then, of course, these little guys coming out of here, those are the nerves. We don't want stress on our nerves. We don't want stress on any of our tissues. However, what happens when you start to get stress on the nerves, it starts sending signals to the body, and those signals are muffled. It's like whatever's at the end of that signal is those organs, tissues, whatever it is, cannot possibly see or hear the proper message in order to function properly. So chiropractic is about looking for these areas of the spine that are not functioning properly because the curves have changed. It's placing stress on the nervous system, muffling the signal. So let's go back to scoliosis. So we want to see, we know we want curves from the side, and we want a straight line all the way down. But what a scoliosis is those curves are like this, and they start to shift side to side like this. Now let's talk about what your organs are here. This is heart, lungs, stomach, digestion. Down here for women, it's menstrual cycles. So we see a lot of effect of menstrual cycles with scoliosis. Anytime you start to change that curve, you can just see that physically, if I do this, I'm going to start to put stress on my organs. You're cutting off blood flow, you're cutting off nerve flow, and the only way to correct this is through chiropractic. So now let's go back to the question again. How do you know if your kids have it? People will bring their kids in, and I've had a recent influx of young teenage girls, and usually they come in because they have some kind of hip pain, knee pain. These kids do not ever come in because their moms or dads say, I want them checked for scoliosis. So this is my call to action to you. I want you to bring your kids in and say, let's check them for scoliosis. Because the longer this goes undetected, the longer you squeeze down and choke off the message to those organs, then the more opportunity there is for dis-ease in the body, for something to go wrong later on in life. So these two cases that I want to talk to you about recently, both of these young girls, one came in because she had hip pain, hip issues, like a lot of clicking and popping. And I don't always take x-rays on kids. I do a physical evaluation. I can oftentimes check, you might see shoulders like this, or the hips could be off, or the pelvis will be rotated, and we assess that through the physical exam. But then what happens is sometimes, and you hear this a lot, they might say, oh, they checked them for scoliosis at the pediatrician. They had them bend over and touch their toes. Anybody ever hear that test? Bend over, touch your toes, you don't have scoliosis. That only shows up when the curve is up here in the mid-back and it's severe enough to hump out part of the ribs. So that test doesn't work. And the only way to get your kids checked to see if they have scoliosis is to get them to a chiropractor, because we are trained to look at balance within the spine to make sure that their bodies are growing at full capacity and full function. So when this happens, and you see this on an x-ray, what's happening is there's interference or a muffled signal to how the body is growing. So chiropractors are the only one that can correct that. When we correct that and start to straighten that out and balance out the body and change the signal and give the body now a clear signal to the growth processes, then when we re-x-ray that, we see these beautiful changes and these reductions in curves, and legs start to grow evenly. And parents I've had more parents literally just crying because they've seen what kind of potential now their child has. They didn't really realize how having scoliosis could affect them longer in life. So the one girl came in with hip pain, and we found the scoliosis on her, as well as a rotated pelvis like this and kind of a short leg like that. So she's walking around like this, and she's a dancer. She dances a lot. And so her parents were freaked out, and I get it, because they said, we weren't expecting to find this. This is what we weren't expecting to get this diagnosis. And then another similar case came in a few days later, and same thing. The parents were freaked out. The little girl came in, she's like 12 or 14, I think, and she came in, she had knee pain. Same thing. Parents are freaked out, not really knowing what to do, and the idea is that this is the only place that you can get this corrected. So one of the parents of one of those girls said to me, I was reading that there's nothing you can do about scoliosis. And I said, and that depends on where you're reading. So in the medical world, the difference is, if you think your child has scoliosis and you take them to the pediatrician, and they'll do that bend over test and tell you yes or no. But if they suspect, they might say, let's take an x-ray. And then they'll take the x-ray, and then they'll say, come back in 6 months, let's see if it got worse. That is called watchful neglect. It's a legit term in the medical field, because they want to watch it to make sure it doesn't get worse, because they don't have any treatment. If it's within a certain degree, if it's not severe, and they don't feel that it's worthy of cutting into the body and putting rods and clamps and cages around the spine to stabilize it, if they don't feel that it's severe enough for that, they will do what's called watchful neglect. So then these kids will just go without treatment for those 6 months. They re-x-ray in 6 months, and they say, oh, it's better, worse, or no change. That's how the medical community handles it. That's all they know, and that's okay, but that's why we are here as chiropractors. So what we do is we do an active watch, I guess, right? So I have to come up with a term for that. So within those 6 months, we're actually adjusting the spine. I've literally done a full evaluation, enough to know exactly where these kids need these corrections in order to improve the signaling to the body's growth healing. And then in 6 months, so we put them on a care program, and in 6 months we re-x-ray. And one of the dads said, isn't it too much x-ray? That's not good for you either. And I said, yes, you're right. Too much x-ray is not a good thing. However, again, in the 23 years of doing this, I've had cases either resolve 100%, these curves go away 100%, almost 100%, or if I've waited too long to take the x-ray and I'm still adjusting them the same way, we could overcorrect, and we do not want to do that. So usually after the first 6 months, and we take that first 6 month x-ray, then what we do is I can change the plan if I need to. And most of the times at 6 months, I have to change how I'm adjusting them, because we've made such incredible changes and corrections of these spine, long-term corrections, that now we've got to keep them there. So we probably don't have to take another x-ray for a year after that point. And then it's critical at this point that you keep your child under chiropractic care until they're done growing, because we want to minimize the opportunity for those signals to get diminished or muffled again and cause an effect on how the spine grows and how the body grows. And you've just given them back this incredible opportunity at life and function for their body. Now, both of these girls are athletes, so for them to actually have a better balanced body and spine and pelvis. The one's a runner, and her pelvis is like this. Can you imagine running completely? If I like ran like this, like crazy, right? So you think when you start to look at what does that look like on the inside of the body, let's get it corrected. So if you have kids who are teenagers, and this is not exclusive to girls, but it does occur more often in girls, if you know that you have scoliosis as an adult, then you must get your kids checked. If you're not sure, if you see things like the purse or the backpack slides off of one shoulder, or you notice uneven wear on the shoes that you're like, why, geez, I just bought you those shoes. Why is the right one so worn out more than the left? That's a sign that they could have undetected scoliosis. And the only person that really has the expertise and the knowledge to not only evaluate it, but to ultimately correct it is the chiropractor. So please let me know if you would like to come in, give our office a call. I would love to check your kids. I'd love to check you for scoliosis. I do see a lot of adults with scoliosis as well, and we weren't able to get 100% correction because unfortunately we're past growth phase, but man, we get function back. And that is really what it's all about. You want to function at your highest capacity. So I wish you best healing. I wish you a great chiropractor, which is me. And if you're not in my area, I know a bunch of great chiropractors out there I can send you to. So give us a call. And if you know of anybody who could benefit from this information, please share this video, like it, and we'll hope to see you and we get all these kids corrected and have them just rock stars going into adults. Okay. Have an awesome day. See ya.